Rodam. I am a nursing student from School of Nursing and Health and Sciences of Biliran Province State University. And today I'm going to perform a return demonstration on measurements in prenatal visits as partial fulfillment of the requirements in our NCM 107 Care of the Mother, Child, Adolescent, or Well client. The purpose of this assessment is to establish a baseline of present health of the mother, to determine the gestation age of the fetus, to monitor fetal development and maternal well-being, to identify women at risk for complications, to minimize the risk of possible complications by anticipating and preventing problems before they occur, and to provide time for education about pregnancy lactation and newborn care. In this assessment, I am going to perform also the clean catch urine and the Leopold's maneuver, in which the equipment to be used are BP apparatus, thermometer, weighing scale, tape measure, stethoscope or Doppler, and KY jelly. Good morning, ma'am. I would like to introduce myself. I am Sandra Lane Rodam and I am a nursing student. I am currently at level 2 of my taking program and I am your nurse for today. Before we start, I would like to ask what language you would want to prefer.
I prefer English.
Okay, so English would be great. So today is your prenatal visit and we will be doing assessment and examinations you. And that includes the assessment of measurements in prenatal visits. We will be doing or performing also the clean catch urine and Leopold's maneuver. Before starting the assessment, do you have any questions?
No.
No? Okay. In performing the assessment, it will consume or take time. But please, do not be worried because most assessment takes time to be able to collect the needed data, both subjective and objective. And the information that I have gathered will remain confidential. And in doing or performing this assessment, it involves observation or inspection, palpation, and auscultation. In palpation, I will be touching the specified parts and all of these were part of the assessment. Okay, so are you ready, ma'am?
Yes.
So, shall we start with the assessment? Okay. The first thing that we need to do is take your vital signs, ma'am. So, simultaneously, I will take the vital signs. So, including the BP, the temperature, your pulse rate, as well as the respiratory rate. So first, let me first take your temperature. Okay, so your temperature is 37 degrees Celsius. And now, let me know your blood pressure. Okay, ma'am, so your blood pressure is 120 over 80. So next, I will take your pulse rate as well as your breathing rate per minute. Okay, so your pulse rate is about 72 beats per minute and your breathing rate is about 17 breaths per minute. So okay, now I'm going to do inspection in your lower extremities, ma'am, for any edemas. Okay, so can you turn around? Okay, there are no edema. You can now sit down. So, okay, at this point, we will be taking your body weight and I want you to remove your slippers, please, as well as your accessories. So, I will now obtain your height and weight of your feet. So, you can go over here so that I can know your weight. So, okay, ma'am, your weight is 70 kilogram. You can go over here. Height is about 145 cm. Okay, now you can sit down. So let me just document all the findings and as well as the information that I have obtained. Okay, so at this juncture, we will be doing physical exam and that includes breast examination, pelvic examination, and screening exams for your heart, lungs, and thyroid. First, I am going to perform the breast examination. Okay, let's move to the next part of the assessment, which is the clean catch urine. In this assessment, we are going to obtain your urine specimen to be used for urinalysis and culture. Okay, so if you are exhausted, ma'am, we can take a break before proceeding to the next part.
No, it's okay.
Okay, we can proceed. So the very first thing that you will do in obtaining your clean catch urine is to wash your hands first as you enter the comfort room to protect yourself from infection as well as to prevent cross-contamination. Secondly, these are the kit that you need in collecting your urine specimen. So this is the container that you will fill with the urine, and these are the cotton balls that I had previously moistened with the antiseptic solution. Or you can use this wipe, so that you can clean also your private parts. And then thirdly, you will sit on the toilet and separate your labia with your non-dominant hand. Then fourth, you will clean your perineum, washing from front to back using the cotton balls which I had shown you previously. Then wiping with only one stroke and then discard it. Fifth is to avoid touching the container as to not contaminate the whole specimen. Sixth, do not directly put the cup to fill it with urine. Allow the first urine to flow into the toilet first. Then, hold the container under the urine stream to obtain 10 to 20 ml, which is about this amount, 10 to 20 ml. Then afterwards, remove the container and release the hand from your labia and finish voiding into the toilet. Then seventh is to cup the specimen container, wash your hands, and bring it here. So now you can proceed to urinating. You can go to the comfort room. So after obtaining the specimen, difficulty during urination should be assessed in order to note for existing health problems. So, okay, you are back from obtaining your clean catch urine. So, while obtaining your clean catch urine, did you experience any kind of pain or discomforting during urination, ma'am?
No.
So, okay. So, are you okay to proceed with the next part of the assessment, ma'am?
Yes, it's okay for me.
So, okay, in the next part of the assessment, we will be measuring your fundal height, perform the Leopold's maneuver, auscultate fetal heart rate, and also, we will be doing pelvic adequacy examination. In Leopold's maneuver, there were 4 maneuver that we need to perform. And all the maneuver includes palpation, which I am going to touch your abdominal area and the superior of your fundus, which is right here. So the first thing that you need to do is empty your bladder. And after that, you need to get back in here to proceed with the next part of the assessment. So you can go ahead and go to the comfort room now. So, okay, ma'am, since you are back from the comfort room, now I want you to lay on the bed and do the supine position with your knees slightly flexed. As I place the rolled towel or pillow on one side and wash my hands with warm water afterwards. Okay, so you can sit as I place. Okay. So can you just lift your. Okay, so let me first wash my hands before proceeding to the main examination. So first, I would want to provide you with privacy since I will be only assessing the upper part of your body. So now I will expose your upper abdomen, and I am going to do observation or inspection in your abdominal area to note for longest diameter and where fetal movement is apparent. So first, I will measure your fundal height in centimeters. So okay, your fundal height is about 19 centimeter. Then we will be doing the first maneuver, which I am going to feel the top of the fundus to determine either the baby's head or baby's buttocks are on the position. So, okay, heads are firm and move independently while the buttocks are soft and move with the body. So now I will proceed to conduct the second maneuver. I will be palpating the side of your uterus to note for baby's back and should feel flat and long, and it is firm and smooth. And the extremities are small and bent. Okay, so this is important to know because this is where we are going to place the bell of the stethoscope to monitor the fetal heart rate. Now, I will be performing the third maneuver to see if the head is engaged and to determine any movement and whether the part is soft or firm. And lastly, we will be performing the last maneuver to determine cephalic prominence. The brow should be on the opposite side of the back. So, okay, now I am going to put back your. So at this point, we will be doing a pelvic adequacy examination. So I am going to introduce 2 fingers vaginally and press inward and upward until the middle finger touches the sacral prominence. This is done to rate the pelvic inlet as adequate for childbirth. So should I start this examination, ma'am? Okay. And in the last part of the assessment, we will obtain your specimen for a complete blood count. So that's it, ma'am. We are done performing finally all the examinations. So I am going to document the procedure and any pertinent observation. So thank you so much for your time and cooperation. And I would like to commend you for actively engaging in doing the assessment and for your patience in performing all those tasks. Have a great day ahead, ma'am. So I'm just going to record all your documentations and findings. You can now go ahead.